Now we'd like to get ahead with the Prime Minister's press conference. First of all, we'd like to have a speech from Prime Minister. The floor is yours, Prime Minister. Right before this meeting about COVID-19, we had a headquarters meeting. And state of emergency declaration, we have decided to issue this declaration. Tokyo, Kyoto, Osaka, and Hyogo, for these 4 prefectures, the period is going to be 25th of April through 11th of May. And priority measures on this front, during this period, Ehime Prefecture was newly added. Miyagi, Okinawa, up until the 11th of May, we have decided to set this period. And across the board, across Japan, the number of infections has been hiking since last month, and the severe cases are also surging rapidly. Osaka and Hyogo daily tally. Out of stage 4, it is happening at the high level, and the medical system has been very, very overloaded. Tokyo, Kyoto, in these prefectures, the number of infections, the rate of increase is now hiking day by day. So-called stage 4 level is now being reached. And in particular, what is concerning is new variants movements. Other positive people in Osaka, Hyogo, about 80%. In Kyoto, it's around 70%. In Tokyo, it is around 30%. We have to stay on alert. As things stand now, without any measures in metropolitan area, the infections surge will be spreading around the world, around all parts of Japan. So therefore, once again, state of emergency declaration has to be issued. And during Golden Week or week holidays, a large number of people will take a rest and take holidays. So during this period, we need to stage effective measures during a limited period of time in an intensive manner. By doing so, the virus momentum has to be curtailed. This is a decision that we have exercised. I myself, so far. We wanted to prevent another state of emergency with full efforts. That's what I have been saying. However, this time around, amid these circumstances, to many people, once again, we have to cause troubles. And sincerely, I'd like to extend my apologies. This time around, under the state of emergency declaration, the source of infection, the center of it is eating establishments. Without limiting the time frame to 9 hours, we'd like to have a thorough measures at the same time. In metropolitan areas, the flow of people and across the prefecture, travel has to be cut back, and people-to-people contact has to be cut back through thorough measures. Number 1, in eating establishments, the alcohol serving has to be stopped. So, involving alcohol, the eating occasions, dining occasions, might entail shouting and long hours of eating and dining. So, therefore, it entails high risks of infections in bars and restaurants in eating establishments up until 8 p.m. The working hours have to be cut back, and then alcohol serving stoppage will be requested. And on the streets, outside bars and restaurants, drinking alcohol shouldn't lead to infections, so thorough attention is required. And karaoke parlors, stoppage will be also requested for the service. Number 2, In order to further curtail the infections, the movement of the people has to be cut back so that the contact between people can be curtailed. And through outings, people-to-people contact can trigger infections. That has been pointed out by experts. In department stores, amusement parks, on top, a large scale of commercial facilities, and in other areas where a large traffic is expected, in those facilities, we will request a shutdown on a temporary basis. And about events and sports without spectators, so that is our request. Unnecessary outings are also requested, and in leisure activities and infection-prone such travel should be also cut back. That's our expectation. And about the telecommuting and using holidays, the commuting has to be 70% versus the normal times. That is our expectation and request. So abiding by guidelines and sustaining businesses, people have tried to curtail and prevent COVID-19 infections. Although it is a limited time, however, a shutdown and such in-depth measures which have to be requested, it's really, really painful for me, and I feel sorry. However, one of the reasons that we have to take such actions is among young people, we have an expansion of COVID-19, and in medical facilities, we have a fierce fighting going on. We have to curtail the infections in the youth so that the highly risky infections to the elderly has to be prevented, and such awareness has to be shared among all the people in the society. That is a strong mandate that we have. And clusters are also diversified, and in welfare and medical institutions and bars and restaurants on top. We have workplace and club activities in universities where we have a lot of infections happening as reported. In welfare facilities, we have to do regular inspections on top. Each individual people, one of us has to take actions, and wearing a mask and washing hand and avoiding 3Cs. Such anti-infection measures have to be thoroughly implemented. This time, we have a large impact on bars and restaurants, accommodation, and commercial facilities, and business continuity is required. In order to make it happen, cash flow measures will be thoroughly implemented. Like we discussed in the headquarters before this meeting, immediate actions were mandated to all the cabinet ministers, and using employment adjustment subsidies, employment has to be protected, and a small emergency fund will be also utilized for people's livelihoods. So just shut down and shorter working hours inflicting bars and restaurants. So support will be needed on a continuous basis. And that's what we will do. In large facilities, regarding the shutdown request, including the tenants, and on top of the employment adjustment subsidies, a new cooperation fund will be provided. Because of declaration, we will have less traffic, and there will be a large decline of sales for such entities. Once again, one type of money is going to be provided. And about the accommodation operators, we have to have and promote the anti-infection measures in those facilities on top. Prefectures driven business continuity has to be supported, and a 50 million yen emergency fund or grant will be set aside. In Osaka, in medical institutions, we have a crisis situation. So the central government and the local municipalities have to unite all efforts so that we can have a coordination for bed utilization, and 400 beds can be set aside now, and from across the nation, nurses and large dispatch including that around 200 people have been also set aside. So we'd like to collaborate between the central government, local government, so that the medical situation can be supported in full efforts.
The vaccine inoculation has started, and many people, in a swift manner, should be vaccinated, and everything possible to be done. That's our determination. First, to medical professionals, and then up until the end of Golden Week, about 7 million inoculations, vaccinations, and then after, about 10 million shots of doses will be distributed to local governments, and then the total of 100 million shots to be distributed by end of June. And regarding the inoculation schedule, to the elderly who wants to be vaccinated, the end of July is the milestone, and the local governments can complete the 2 times of vaccination per person. That's our policy, and many municipalities have a challenge of the human resource. And to the vaccination centers, we dispatch the nurses, and also the vaccination by the dentist will become possible. In a U.S. visit, we made a request to the CEO of Pfizer, and to all who wants to be vaccinated, they will receive the vaccination. The supply will be secured by end of September. And to those who hope to be vaccinated, we do everything we can. The novel coronavirus, the fight against the virus in the world, we are making some advancement and also some challenges. There is the repeated waves of the virus, and we can make no prediction about the future. However, in the past experience, we have learned and we've accumulated knowledge, and we have a weapon of vaccines. So this is the tough battle we are waging, but we are confident we will win based on the state of emergency. The suspension of a serving of alcohol is a first, and then reducing the foot traffic and getting the support of each one of the Japanese people. That's my sincere ask to every one of you. With that, we can have the lives with the peace of mind once again, and the vaccinations and other measures as the government and as the cabinet, we do everything we can. And understanding of the Japanese people is what I ask for you. Thank you very much. That's all from me. Then we will take a question from the floor. Mr. Omi, please proceed to your position on the stage. Depending on the question, we will ask Mr. Omi to answer a question. Those who are appointed, please proceed to the microphone near you, and then please state your name and affiliation, and state your question at one time. First, TV Asahi Yoshino-san, please. Thank you very much for the opportunity. First, regarding the criteria of a lifting of a state of emergency, what will be the requirement to lift the state of emergency? If we cannot meet the criteria of stage 3, is it going to be extended? And Tokyo Olympics and Paralympics, in the current situation, do you think you want to hold an event, or do you think it is possible to hold an event? First, regarding a lifting of a state of emergency, we need to give a comprehensive consideration at that time, but this time it is a short-term and intensive state of emergency, and we have stronger measures on a dining and a wining establishment, and stopping the serving of alcohol. And in order to stop the flow of people, we ask the events to be suspended, and also the large commercial facility to suspend the business operation. Those are the thorough measures we are taking to achieve our target and for Tokyo Olympics and Paralympics. First, our first priority is to curtail the infection, and IOC has already made a final decision to hold Tokyo Olympics and the Paralympic Games. And with IOC and also each Olympic committees, we've already confirmed about the holding of the games, and we make sure that we stay closely aligned so that we can actually hold the events. Then,
Japan Times, Mr. Sugiyama. Japan Times. I have a question for Prime Minister. At the end of last year, already in overseas nations, there was a report about new variants, and there was a warning from experts. However, you have decided to lift the state of emergency second time around. However, we had a surge of infections afterwards. Do you think that the administration was not really serious enough? And in March press conference, in order not to have a state of emergency once again, 5 measures have to be thoroughly implemented as your responsibilities. However, vaccination is one of the pillars, and it is being delayed. And how do you see your political responsibilities in this regard? Because we have another state of emergency. Regarding the last time lifting the number of the tally and the bed utilization, and based on the situation and listening to the opinions of experts, we have lifted. For example, in Osaka, when lifting was done, the new infections was 72. From stage 4 to stage 3, once we have such a transition, then we thought that it's going to be one milestone for lifting the state of emergency. And stage 3, 315 and 189 for stage 2, and 72 was the number at the time, and 50 for bed utilization, stage 4, and stage 2, it's 20. At that time, it was 29.8% in terms of bed occupancy. So all in all, amid such circumstances, we have decided to lift the state of emergency. And this time around, for this state of emergency declaration, the new variants is a key. Like I said in the beginning, in Osaka and Hyogo, we have 80% of the infections coming from new variants. So such countermeasures have to be staged, which is important. However, staging such countermeasures, we have basic countermeasures, which are traditional measures, which have to be thoroughly followed. And by doing so, the countermeasures will be taken. This time, we need to curtail the foot traffic during Golden Week period in an intensive manner. That is the countermeasures that we have decided to stage.
then we take question from other press. Those who want to ask question, please raise your hand, and I will appoint a press to ask a question. Please, one question at a time, please. Hokkaido newspaper, please. Hokkaido newspaper, I am Sato. I have a question to Prime Minister. The government identified the intensive measures to be taken in a dining establishment, but now it is diverted to focus on the reducing of foot traffic. We have an increasing concern about the infection increasing from the variants, and was the judgment made by the government before, was it a wrong judgment? And I have another point to make. Regarding the priority measures to prevent outbreak, Hokkaido is also seeing a resurgence of infection. And how do you see the current situation of Hokkaido? Because Hokkaido just asked to the government for the priority measures to be taken. Every week, on Tuesday. And then from next Tuesday, the shortened operation hours to 9 p.m. Will be starting. That's what I heard. I will work closely with the Hokkaido government to control the outbreak. And regarding the history up until the state of emergency, as I said, the new variants in Osaka and Hyogo centrally, the rate is about 80%. And the increase of new cases from variant is the current situation. And now we see a big portion of the infection coming from the young people. Young people get transmitted and then they bring the virus to home. In that sense, we need to stop the foot traffic. That's what the experts have pointed out, including Mr. Omi. And can I have a comment from Mr. Omi, please? Regarding your question, before we concentrated our measures on the dining establishment, but now we are focusing on the foot traffic. And why have we changed the focus? And this time, because of the new variants, our current situation now have entered into a new phase. There are several reasons for that. One is that diversified the venues and the locations of the transmission. And as Prime Minister said, because of the impact of the new variants, now the transmission is getting more easier, and relatively young people also start to develop severe symptoms. And now we are seeing such a rampant infection. The dining establishments shortened operation hours, of course, it is going to be critical in going forward as well, but person-to-person contact, people contact need to be prevented, need to be avoided. That's what's required more than before. So in that sense, commercial facilities suspension request, it is to minimize the opportunity of people contacting with each other. Because of the current situation, we are trying to reduce the number of contacts of person to person.
日本テレビの
Nihon TV, Amano-san, please go ahead. Amano with Nihon TV. I have a question for Prime Minister. This time, 3 months out of 4 months, we had either a state of emergency or priority measures. And upon each juncture, so you have said that you need to contain the spread of COVID-19. However, priority measures and the state of emergency effects were not validated. However, the state of emergency is now declared, and you'd like to curtail the infections among the youth. Noda Yojiro, a renowned singer, said that this person doesn't have an intention to listen, and people are getting frustrated. And in order to maximize the effects of this declaration, once again, how are you going to appeal to the people? How are you going to face how they feel for cooperation? Like I said in the beginning, for the declaration, once again, we have to cause troubles to many people, especially up until today, we had various measures, and there was a cooperation, and there were many countermeasures taken by various people. And there are also some areas without any cluster infections for those people in order to put hold on the foot traffic. We have some constraints that we have to impose on those people. I feel so sorry. In order to make these measures really effective, once again, we need to solicit cooperation from those people. Like I said before, that is the way that I feel. So we'd like to make it really as short as possible. So therefore, during Golden Week period, using such period, for a short period of time, we'd like to stop the traffic. We have a fresh declaration for COVID-19. And with this, with people of Japan, once again, we'd like to ask, once again, cooperation. Dr. Omi, do you have anything to say? So there was a mention of priority measures. And this time, we are now having the third round of declaration for emergency. Regarding this pandemic, we cannot totally eliminate the infections. So, like I have said before, we have been talking about the rebound to be happening. So from now on, we need to detect early signs of rebound. On April the 15th, in a subcommittee meeting, we said that we need to discover signs as soon as possible. And regarding the timing for staging the measures, we gave more in-depth recommendations. So I'm sure that we will have another wave or infection surge. So in order not to have any medical strain, we have to be flexible and we have to be preemptive for taking measures. So based on the recommendations, we have come up with some indicators for such measures. So I'd like a local municipality to refer to that.
ドワンゴの七尾さん。
Nanao-san from Duango, please. This is Nanao. Thank you very much for your hard work every day. During the state of emergency this time, I think many companies will take a day off, will take a holidays, and after Golden Week, if the state of emergency is lifted, the commute cloud will start again. Then more than 80% haven't practiced the remote working. Just the restaurants and the commercial facilities have been sustaining this pain. And there are many companies who haven't even started the remote working, which is not fair in the current Special Measures Act. There's no such an order can be made to suspend or not conduct a office attendance. So reducing the commuters' office attendance, the new card may be necessary in order to ensure to reduce the office attendance to the business. In business offices, the infection is spreading. In order to stop the foot traffic, the remote working need to be thoroughly practiced. So the business office measures are also very important. And as you pointed out, it is a one way of thinking. First, remote work. Utilizing remote work and such an environment at the business practice. That's something once again I would like to ask to economic circles and business industries to really taking up the practice of remote working. Initially, when we issued state of emergency, the 70% of the people or the company actually conducted the remote work. So this is something we would like to ask to the economic circles again.
幼いさん。
NHK Osanai-san. Osanai with NHK. I have a question for Prime Minister. This time, during Golden Week period, you'd like to stage short-term and intensive measures. And once again, people are taking a lot of holidays. And during year-end and a New Year period, you couldn't curtail traffic. How are you going to reflect your lesson learned? From last year to this year, during year-end, New Year period, and especially at the end of the year, we had many parties, like Christmas parties and others. And we had a surge of infections, which is a fact. We have a lesson learned, and based on that, we have decided to boldly take measures for stopping foot traffic. At any rate, we are causing troubles to people, so we'd like to minimize such troubles. In order to make it happen, the Golden Week has to be really utilized. So this time, we listened to the opinions of experts to stage such measures. Dr. Omi? As you pointed out, yes, last year, when we had the second emergency of declaration, and one of the reasons for staging the declaration repeatedly from the central government and local municipalities, there were many requests. However, because of different reasons, during year-end period and the New Year period, we wanted to stop such occasions. However, it wasn't well communicated. So through this, through traditional celebrations, we tend to have rapid surge of infections, which is a lesson learned. So therefore, this time, during the state of declaration period, which is a Golden Week, and people usually want to enjoy this period. And as an individual, as a person, of course, I don't like it. However, in order to prevent the same thing from happening during Golden Week, at least I'd like you to cut back on unnecessary outings, which is important. At the same time, once we have a lifting of the state of emergency, we might have a surge. And on the 11th of May, when we have another assessment, we have to, because we have an infectivity of the new variants and the complications, possibilities, and we have to also consider possibilities of rebound before lifting the emergency.
それでは
Mr. Otsuka from Gigi, please. Otsuka from Gigi. Prime Minister, you talked about the support to business operators. The supplementary budget, current fiscal year supplementary budget, do you have a plan to revise the supplementary budget to support the business operators? This state of emergency is centering on the Golden Week. So this is a short-term and intensive measures, and through various measures, the people affected by the reduced foot traffic and business suspension, we would like to support them. Regarding a fiscal source, we already allocated the budget, and depending on the necessity, the COVID contingency fund of 5 trillion yen, that's what we're going to utilize. So the supplementary budget is something that I'm not considering.
Video News, Jimbo-san. Thank you. Video News, Jimbo. Prime Minister, as a Prime Minister, you said that you'd like to do everything that you can, and it's a very serious word. And once again, my question is about the state of emergency declaration, and we have a surge of infections. However, as a number, still, for example, compared with the peak time in the Western countries, is fewer. And one of the biggest causes for the state of emergency is the Japanese very vulnerable medical system, which can be easily overloaded. So we cannot separate the link in between. So here's my question. Prime Minister, even with his authority, we have the largest number of beds around the world. However, and 1% COVID-19 beds. Do you think you can change this? Under the authority of Prime Minister, are you saying that you cannot change the allocation or the number of COVID beds? Or you don't think that the priority is not attached to such an action, so therefore we have fewer beds than expected? So that's why we have to stage a declaration like this immediately. And if you cannot do it, why is that? And if you are doing everything that you can, and if you don't have a lumping up, then why is that? why can't we have an increase of COVID deaths in Japan? I think it's of everyone's interest, so please educate us. In this COVID-19 situation, for medical workers, the authority of the government is currently based on a request, which is a fact. And as for vaccinations, compared with the world, as often criticized, we have disparity. And clinical trials in domestic sphere and overseas clinical trials. And in overseas nations, many countries don't need domestic ones. And in the United States, for example, once the vaccinations are completed, then they can be utilized. However, in Japan, we have to do clinical trials domestically, which is our framework. So therefore, for this kind of state of emergency, we have some needs associated with the laws and regulations, which I thankfully feel. And for hospitals, we are providing some budget, and the budget allocation is made from the central government. However, the central government doesn't have such an authority. So upon this kind of state of emergency, because we have some lessons learned once again from the epidemics, which is happening right now. So once everything is calmed down, upon this kind of a state of emergency, special measures have to be set up. That's what I think. However, right now, in the central government, with the local municipalities, we have to ask for cooperation, and there are many people who are giving us hands and help. And there are many people who are working so hard in the field, in medical institutions. With that in mind, when it comes to Japan, amid these circumstances and reality, the state of emergency declaration has to be staged. That's where we are. But about the state of emergency, for example, when it comes to vaccinations or therapeutics, once we have clinical trials, and of course we have some limitation of numbers, but in order not to have such a status, during normal times, we have to have solid legislations in place.
続きまして東京
Next, Mr. Shimizu from Tokyo newspaper, please. Hello, this is Shimizu. Tokyo Olympics and Paralympics. Regarding the criteria for the decision of Tokyo Olympics and Paralympics. And the infection was moderately increasing, but the government lifted the state of emergency last time, and this time the deadline of the current state of emergency is set at May 11th. This is due to receive the visit of the chairman back of IOC that is being talked about, and many Japanese people feel that this situation will not tolerate to have actually hold Tokyo Olympics and Paralympics. And you, Prime Minister, stated this week that Tokyo Olympics and Paralympic games can be held. But you seem that you are disregarding the current situation. Are you taking priority higher on the Tokyo Olympics and Paralympics over the lives of the Japanese people? What will be the conditions or the numbers and criteria that will allow the government to hold the Olympics? And I believe the government should share such indicators with the Japanese people. The torch relay, Olympic torch relay, is not the reason of the lifting of the last state of emergency regarding Tokyo Olympics and Paralympics. The IOC holds the authority of a holding of a Tokyo Olympic and Paralympic Games, and the IOC has already decided to hold Tokyo Olympic and Paralympic Games, and in order to have a safe games at the IOCs and also with the related stakeholders, and also at the Japanese government And at the committee, we are taking various measures, and not receiving the overseas spectator is one of those measures. And containing the COVID-19 virus and protecting the lives of Japanese people, that is our responsibility, and also at the same time hold the Olympic Games.
Igar-san, please answer. Igar-san. Follow-up question. Egar Shoko of freelance. Regarding Olympic, you said that the IOC has the authority or decision-making power. However, when it comes to the IOC, they are not responsible for the lives and the livelihoods of Japanese people from this perspective. And you also made a speech where the situation doesn't allow any mistake. And Dr. Omi said we will have a rebound for sure down the road. I think, I understand your determination to carry it forward. However, under what kind of situation do we have to, or are we forced to call off the occasion? Do you have any criteria for decision making? If so, what is that? Because that leads to people's peace of mind. And from overseas, spectators will not be invited, you said. However, the Olympic IOC and the athletes or IFs related people and a large number of media related people will be coming into Japan. So these people might bring in new variants. So in terms of the countermeasures for preventing this, what other specifics that you have in mind? And I would like to also listen to the opinions of Dr. Omi. First, about the IOC and about the Olympic Games. The IOC has a consultation with each organizing committees in each nation before making a decision. Japan also was the one who invites the people. So within TOCOG, and we have to make a decision making and a decision making body. And right now, they are slated to stage this game. And with this in mind, IOC and the TMG and the TOCOG and the Japanese government, we had a meeting. For instance, like I said before, we will not invite any spectator from overseas nations for cheering up the games. And in the athlete group, we have also had a consultation around the number of people who are coming into Japan. We try to scrutinize the number of people. And about the quarantine measures and border control, we are stringently doing this work. And about the PCR work, it has to be done before they come into Japan and right after they come to Japan. And in Japan, the venues and all the actions and behaviors will be traced in Japan for those people who are coming into Japan. And we have to also cut back on, or we have to put some restraints around the actions. For example, when they go to the sites, we have to set aside specific routes and channels for transportation. So the people with new variants, they have to be stopped from coming into Japan. So we have the right measures in place. I also would like to say something on this about the holding of the Olympics, and regardless of the Olympics, the Japanese residents' health and the welfare and health institutions have to be protected, and the surgery infections and the medical strain have to be avoided.
千田さんどうぞ。
Mr. Chida from Fuji TV, please. This is Chida from Fuji TV regarding LDP president election. And with the Japan-U.S. summit meeting, regarding President Biden, you stated that you have the lot of the empathy to President Biden, and you said that you want to continue to build a relationship with U.S. President Biden, and do you want to be re-elected as LDP president? Regarding LDP president election, I get a lot of question about that. First, the containing the COVID infection, that is my first priority. But I do have a tenure, which is a fact. Me as the president, during my term, I will need to take time to consider about the election. But for the LDP president election, the first my priority comes to the COVID response.
通信の吉
共同通信吉浦さん。The repercussions on the Japanese economy. These emergency measures will be intensive and a short time. On the other hand, business shutdown, it is very specific and strong measures included. And by having this, what are the adverse effects on the Japanese business? The annual and quarterly GDP in this regard, what are the criteria that you'd like to achieve, for example, in your mind? This set of emergency declaration, we will have many businesses taking rest, and during golden holidays, we'd like to have these intensive measures, and various measures will be also taken on top. And foot traffic should be curtailed. By doing so, in relation to this, we'd like to support businesses as much as possible. And in order to curtail foot traffic, there has been a lot of cooperation. So therefore, during this period of time, the surge of infections has to be prevented. If we can do it, then I think that the impact is going to be somehow limited. However, the people who cooperated will be supported with the right measures.
Mr. Fujita from Nippon Keizai newspaper, please. This is Fujita from Nikkei newspaper. The COVID-19 vaccine. After Golden Week, at various locations, the full-scale inoculation will start. And then the second vaccination of elderly should be completed by end of July. But the local area says that not enough vaccinators and so forth. And Minister Kono and Minister Takeda, you recently made an instruction to strengthen the measures for the inoculation, and what are the measures are you going to take to the municipalities, the vaccines, delivery of vaccine? Those were their strong concern, and as I said, after Golden Week, holidays. By the end of Golden Week, the total over 7 million dosages. And then after Golden Week, every week, the 10 million dosages. And by end of June, about 100 million dosages. We do have a visibility. And the actual inoculation structure and capacity should be established. And there are some areas with a shortage of doctors or the shortage of nurses, and with this bottleneck, we will address as the Japanese government by end of July to elderly, we would like to complete the 2 dosage shots.
それでは大変恐縮でございます。
I'm sorry, but we'd like to take now the last 2 questions. Kuromi-san, Yomiuri newspaper. This time, as for the government, you'd like to curtail foot traffic, and the economic activities will be very limited through this measure. And the start of the declaration is 2 days later, and we have a very limited time frame for disseminating information. Don't you think that that will cause some chaos in the people's lives? First, regarding the Golden Week, people take rest during this period, and using such occasion, we'd like to stage strong measures in a limited time frame to curtail infections. Now, there are many establishments, business operators, and sports and events. For these people, there will be a lot of ramifications. However, during this period, we'd like to put a lid on the curve of infections, and in order to make it happen, we are asking for cooperation and staging a state of emergency declaration. So the people related to theaters and footballs and baseballs, and for those people on a daily basis, people are taking anti-infection measures, even for those people, because we have to curtail foot traffic. So once again, we need to ask for their cooperation, and it's really painful.
では最後
Last question. Mr. Hatanaka from Nippon Hoso, please. This is Hatanaka. Thank you very much for the opportunity. State of emergency, this is the 3rd time. The past 2 times, 1 month, it was set initially for 1 month, and both they were extended. And this time, just over 2 weeks. How should we interpret this? It feels not so inappropriate to us. And you said that it happened to be 2 weeks, but is it just initial 2 weeks, and could be an extra weeks, or is there any scientific based foundation for the decision of this just over 2 weeks, because it coincides with the Mr. Bak's visit to Japan? This time, the state of emergency, the locations for the priority measures to prevent outbreak, those the state of emergency areas are the priority measure areas, and those are based on the priority measures areas. With that, next 2 weeks, that's how and where we set the time frame. Because up until today, those areas have been implementing priority measures. Dr. Omi, can I have your comment, please? Regarding the opinion, regarding the duration, there are various opinions, and the duration itself is important, but as it is said, we want to prevent the strained situation of medical capacity. So what will be the situation and condition for lifting the state of emergency? And at that time, as it is stipulated on the basic policies, I think we should abide by the basic policies, which means that the minimum stage 3 situation, and toward a stage 2, it should be stable direction and trend toward stage 2. And after the lifting state of emergency, it is also very important. The impact of variant need to be assessed, and measures, countermeasures for variants need to be taken, and which is important and also need to be clarified in advance.
それでは
Thank you very much. Then I'd like to conclude the press conference. For those who are raising hands, I'm afraid to ask this, but please send your question, one question to us by email, and then we will respond to you with the Prime Minister's answers. Thank you very much for your understanding. With that, we now conclude the press conference for today. Thank you very much for your cooperation.